The Senate Committee on Health, Education, Labor, and Pensions will come to order. Today is a busy day, as we all know. A very important vote is going to be taking place, and Republicans, Democrats will be meeting in their caucuses, so people are going to be coming in and out. I also think that this hearing is important enough that we extend the time for questioning from the usual 5 minutes to 7 minutes, if that's okay with folks. Let me begin by welcoming the CEOs of Bristol Myers Squibb, Chris Boerner, we thank you for being here. CEO of Merck, Robert Davis, we thank you for being here. And the CEO of Johnson & Johnson, Joaquin Duato, for being with us this morning. Thanks very much. There is a lot of discussion in our nation about how divided our people are on many issues, and that is absolutely true. But on one of the most important issues facing our country, the American people, whether the Democrats, Republicans, Independents, Conservative, Progressive, could not be more united. And that is the need to substantially lower the outrageous price of prescription drugs in this country. According to a recent poll, 82% of Americans say the cost of prescription drugs is too high, and 73% say that the government is not doing enough to regulate drug prices. As a nation, we spend almost twice as much per capita on health care as do the people of any other country, $13,000 for every man, woman, and child. And one of the reasons that we spend so much is the high cost of prescription drugs in our country. The outrageous cost of prescription drugs in America means that 1 out of 4 of our people go to the doctor, get a prescription, and they cannot afford to fill that prescription. How many die as a result of that? How many suffer unnecessarily? Nobody knows. But my guess is it is in the millions, and I have talked to many of them in Vermont and around the country. Meanwhile, our insurance premiums are much higher than they should be, and hospital costs are soaring because of the high cost of prescription drugs. Further, the cost of prescription drugs in this country is putting an enormous burden on taxpayers and seniors by raising the cost of Medicare and Medicaid. Medicare alone spends at least $135 billion a year on prescription drugs. So this is not only a personal issue, it is an issue of the federal budget. Meanwhile, as we pay by far the highest prices in the world for prescription drugs, 10 of the top pharmaceutical companies in America made over $110 billion in profits in 2022. They are doing phenomenally well, while Americans cannot afford the cost of the medicine they need, and the CEOs in general receive exorbitant compensation packages. This morning, we're going to hear a lot from our CEO panelists about how high prices are not their fault and that the PBMs are forcing Americans to pay much higher prices than they should be paying. But let us be clear. In 2022, Johnson & Johnson made nearly $18 billion in profit, paid its CEO over $27 million in compensation, and spent over $17 billion on stock buybacks and dividends. That same year, Merck made $14.5 billion in profits, handed out over $7 billion in dividends to their stockholders, and paid its CEO over $52 million in compensation. And Bristol Myers Squibb made $8 billion in profits last year, while recently spending over $12 billion on stock buybacks and dividends, and giving its CEO over $41 million in compensation. Now, why did a majority of members of this committee invite these 3 pharmaceutical CEOs to testify today? And the answer is pretty simple. Mr. Boerner, we will want you to explain to the American people why Bristol Myers Squibb charges patients in our country $7,100 a year for Eliquis, when that same exact product can be purchased for just $900 in Canada and $650 in France. Mr. Duato, we're going to ask you why Johnson & Johnson charges Americans with arthritis $79,000 for Stelara, when that same exact product can be purchased for just $20,000 in Canada and just $12,000 in France. Mr. Davis, please tell us later why Merck charges Americans with cancer $191,000 a year for Keytruda, when that same product can be purchased for $112,000 in Canada and $91,000 in France. And let's be clear, Johnson & Johnson, Merck, and Bristol-Myers Squibb are not just charging higher prices in the United States compared to other countries. They are also charging Americans much higher prices today than they did in the past, even accounting for inflation. From 2004 to 2008, the median price of innovative new drugs sold by these three companies was just $14,000, inflation accounted. From 2019 to 2023, where we are today, the median price of new drugs sold by these three companies was $238,000. In other words, Americans are forced to pay higher and higher prices for the drugs they need to survive. And let's be clear, the overwhelming beneficiary of these high drug prices is the pharmaceutical industry. How do we know that? Well, that is precisely what they tell their investors. According to their own shareholder reports, Bristol-Myers Squibb made $34 billion selling the blood thinner Eliquis in the United States, compared to just $22 billion in the rest of the world combined. Make their money in the United States. In other words, the U.S. accounts for nearly two-thirds of all global sales of Eliquis. Not a single dollar of this revenue is going to PBMs. 100% of it is going to Bristol-Myers Squibb. Johnson & Johnson has reported to its shareholders that it made over $30 billion in revenue selling the arthritis drug Stelara in the United States since 2016, more than twice as much as the rest of the world combined. Nothing to do with PBMs. Merck has reported to its shareholders that it made $43.4 billion selling the cancer drug Keytruda in the United States, compared to $30 billion in the rest of the world combined. Now, our CEO panelists from the drug companies will tell us this morning how much it costs to develop new drugs and how often the research that they undertake for new cures is not successful. And they are right. We appreciate that. But what they have not told us in their written testimony is that 14 major pharmaceutical companies, including Johnson & Johnson and Merck, spent $87 billion more on stock buybacks and dividends over a recent 10-year period than what they spent on research and development. More on stock buybacks and dividends than in research and development. In fact, Bristol-Myers Squibb spent $3.2 billion more on stock buybacks and dividends in 2022 than it spent on research and development. Johnson & Johnson spent $46 billion more on stock buybacks and dividends than it spent on research and development since 2012. In other words, these companies are spending more to enrich their own stockholders and CEOs than they are in finding new cures and new treatments. Now, the average American who hears all of this is asking a very simple question. How does all of this happen? What's going on? How could drug companies charge us, in some cases, 10 times more than they charge Canadians or people around the world for the same drug? How do they get away with this when so many of our people cannot afford the high price of the drugs that they need? How can it be, uniquely among industrialized countries, that these companies, not just these companies, but the pharmaceutical industry in general, can raise prices anytime they want, to any level they want? Want to raise double prices? Do it any way they want. How do they get away with all of that? And here, in my view, is the answer. The United States government does not regulate drug companies with very few exceptions, the drug companies regulate the United States government. That is the sad state of affairs in a corrupt political system. Over the past 25 years, the pharmaceutical industry, not just these companies, the entire industry, spent over $8.5 billion on lobbying and more than $745 million on campaign contributions. And let me be fair here. Don't want to misspeak. They are bipartisan. They give to Republicans, they give to Democrats. And I am especially impressed by the Pfizer drug company. Pfizer is not here this morning, contributing $1 million to the Republican Party in Kentucky to expand its headquarters, named after Republican leader Mitch McConnell. But again, it's not just Republicans, it's Democrats as well. Unbelievable. This is an astounding fact. Last year, drug companies had over 1,800 well-paid lobbyists here in D.C. to make sure that Congress did their bidding. There are 535 members of Congress and 1,800 well-paid lobbyists, over 3 for every member of Congress. So if you want to know why you're paying the highest prices in the world, America, that's why. Now, here is some good news in the midst of all that. We are beginning to take on the greed of the pharmaceutical industry. As a result of the Inflation Reduction Act passed several years ago, Medicare, for the first time ever, is beginning to do what every major country on earth does and what the Veterans Administration has been doing for over 30 years, and that is to negotiate the lower prices of drugs, including Januvia, Stelara, and Eliquis. Let me conclude by saying this. I am proud of what this committee up to this point has accomplished. Last year, as you'll all remember, the CEO of Moderna committed during a Health Committee hearing that his company would make certain that no one in America would have to pay for their vaccine out of pocket. We appreciated that. In a separate Health Committee hearing last May, the CEO of Eli Lilly committed that his company would not raise prices on existing insulin products after having, in fact, lowered them. But let's be clear, much more needs to be done. I look forward to hearing from our CEO panelists this morning as to how they are going to go forward to substantially lower the cost of prescription drugs in this country. Senator Cassidy, you're now recognized for an opening statement.
Thank you, Chair Sanders. Let's just be clear. Everybody on this panel cares about the high cost of prescription drugs and wants to work on real solutions to address this. But it's also clear that this hearing is not about finding legislative solutions. It's kind of following a formula. We publicly attack private, well, I don't, but others, publicly attack private citizens for being successful under capitalism. We grossly oversimplify a problem and blame corporations. We demand CEOs come before the committee for public verbal stoning. We reject the offer to send top executives with subject matter expertise and responsibility regarding the issues at hand and threaten a subpoena when CEOs are suspicious that they won't get a fair shake. Hold the hearing, get sound bites, then pick another set of CEOs for a show trial, but we don't pass meaningful legislation. If that sounds familiar, that's been the hearing with Starbucks founder Howard Schultz, Moderna CEO Stefan Bancel, and now this hearing with the same formula. I would have gladly joined the chair in exploring solutions to address the high cost of prescription drugs. I'm a doc. I worked in a public hospital for the uninsured for 25 years. I did my best to get care to those who otherwise would not have received. I am aware of this. I'm also aware of the perverse incentives, the kind of like, my gosh, it shouldn't be high, but it is high. Bad actors game the system, and we need solutions that benefit patients and improve access. But the majority was not interested in working with this side of the dais to hold a serious hearing to inform serious legislation. They didn't seek Republican input. The goal was to haul you guys in, to cry capitalism and blame these corporations for the high cost of drug prices. Now, by the way, of course drug companies play a role, and hopefully we'll get answers today to legitimate questions about how drugs are priced. But the problem is far greater and more complex than individual companies, or even a set of companies within an ecosystem which is incredibly complex. Why do Americans pay more for certain drugs than patients in other countries? To understand, we need to have a serious effort to navigate the network of perverse incentives throughout the healthcare system. I lived in it for 25 years. I am very kind of aware of it. Taking a substantive look at insurance benefit design, price transparency, regulatory barriers, intellectual property barriers, the perverse effect government discount programs have upon prices charged to commercial patients, etc. One example, just to say, again, a little bit of complexity here. The 340B drug program resulted in a $54 billion in drug discounts in 2022. But we actually don't know if those discounts lowered prices for the patient who bought the drug. There are reports that patients paid cash when the intermediary took the full price, even though 340B should have lowered it. That is a serious investigation being conducted by this side of the dais that the other side of the dais was not interested in participating in. That is an understanding of an ecosystem. I understand there's no one more eloquent than Chair Sanders on Medicare for All. And we can cherry pick examples of how other countries are doing something better. I can cherry pick the opposite. Canada is struggling, just to show you that there's a complexity here. Let me just take an example. Canada is struggling with specialty care. In May of last year, the Canadian government began to send 4,800 Canadians from British Columbia to Washington State to, quote, ensure people have faster access to life-saving radiation treatment, end quote. They can afford their system because we're right next door. Relatedly to this hearing and to that, Alison Decluseau, a Canadian woman, paid for her own treatment in the United States after the Provincial Health Authority in British Columbia denied her access to life-saving chemotherapy. Canada had a lower-cost drug so low they didn't carry the chemotherapy. So she paid for it out of pocket in the United States so she could have life-saving chemotherapy. The United States is not perfect, but if we cherry-pick from other countries, we have to do a more thorough investigation to see is there a balance there. Now let's return to prescriptions. Canadians pay less than we do. Let's figure out why. But let's also point out that public health insurance in Canada only covers 21% of newly developed drugs. Now, maybe that's a trade-off, but I can tell you, you tell an American that they can't have access to a life-saving drug, they're going to see you in court. They're going to sue, and they're going to say, I want that access. The UK only covers 48% of newly available drugs. Americans just would not tolerate that. It's fair to say that Ms. Decluseau, or those radiation treatment patients, or those not getting the newly developed life-saving drugs as quickly, might die in those countries that don't have access to the same treatments as do we in the U.S. These are serious questions. One more time, I'm a doc. I am aware of this. But we need to fully consider all these issues and then maybe bring you in at the end. But we'll bring in with a context which is complete as opposed to isolated. As I said at the start, it would be best if this were a genuine exercise. I am so willing to do the work on this, as are my colleagues. We've shown that willingness on work on PBM reforms and generic drugs. And even though the chair and I got off to a rocky start, we did some pretty good work on that, Mr. Chair. I think we've got some good bipartisan legislation. So this committee, I agree with you, can accomplish that. But I don't want the committee to devolve into a CEO whack-a-mole, ends up with no serious legislation as a result. Further proof of what I consider the unserious and cynical nature of this hearing is that the minority asked the chair to have a witness on the panel that could actually explore some of these issues side by side these CEOs. That was turned down. We wanted an academic expert in drug pricing who could provide unbiased and substantive input to the issues at hand. Our witness was not allowed. He'll be on the next, but the way this works is this gets all the publicity and the next one gets crickets. And so we've not had that opportunity. And I'll also point out we didn't split the majority and minority witnesses into different panels during several hearings which promoted kind of labor union issues. I can think of no reason to not allow our witness to be here now, except perhaps ruining the optics. As I said at our last markup, what ends up being hollow messaging gives D.C. a bad reputation. Folks want real answers. They want relief from high prices. It is in part what we're going to hear today, but it will be separated from a context that would have made it a lot more productive. If you're telling voters you're going to do something when you know at the get-go you'll have no legislative solution which emerges. And that's why folks don't trust. So if we're just looking for a social media clip, then I suppose we've accomplished something. But let's make a difference for the people whom we represent, for those patients in hospitals where I once treated who otherwise would not have access to care. We have the ability to craft meaningful legislation. Let's do it. With that, I yield.
Thank you, Senator Cassidy. Our first witness will be Joaquin Duato, Chairman and CEO of Johnson & Johnson. Mr. Duato has served as Johnson & Johnson's Chairman since 2023 and Chief Executive Officer since 2022. Mr. Duato, thanks very much for being with us.
Chairman Sanders, Ranking Member Cassidy, and members of the committee, thank you for the opportunity to be here today. Johnson & Johnson has collaborated with this committee over several decades to advance healthcare solutions for patients, including on diversity on clinical trials, nursing and healthcare workforce, pandemic preparation, mental health, and regulatory pathways for novel cell and gene therapies. I applaud this committee for your commitment to such critical priorities. I have been with J&J for more than 35 years and have held roles in Europe and in the US. I understand the global challenges and complexities of healthcare innovation and delivery. And today, I look forward to discussing our approach to pricing and the work we do to advance healthcare for all Americans. Fundamentally, our decision-making is guided by the values set forth on our credo, which states that our first responsibility is to the patients. Our drug pricing decisions reflect our commitment to bringing forward innovative medicines for patients today and for patients tomorrow. First, our prices are based on the value our medicines bring to patients, the healthcare system, and society. We take into consideration that our medicines improve patients' quality of life and survival rates, while often reducing healthcare costs. And for context, in 2022, the average net price of our medicines declined for the 6th year in a row by 3.5 percentage points. Over those 6 years, prices have declined by almost 20%, and the real inflation-adjusted price decline was more than 40%. Second, we price our medicines to support patient access. In 2022 alone, we paid $39 billion in rebate, discounts, and fees, almost 60% of the average list price of our drugs, with the intent that patients benefit from these substantial cost savings. We also support patient affordability and access by funding patient assistance programs. In 2022, these programs help more than 1 million underinsured patients, and we donated $3.8 billion in free medicines and other support to help patients with no insurance. Finally, we price our medicines to meet our commitment to innovate and develop differentiated and novel medicines for patients. The investment required to do so is massive. The average cost of bringing a drug through clinical trials in our industry is more than $2 billion. However, more than 90% of the drugs that enter clinical trials do not make it to patients. Consequently, our R&D investment is enormous and totals near $78 billion since 2016. Despite the tremendous investment required to bring drugs to patients, drug costs in the U.S. have not increased significantly as a percentage of total overall healthcare costs. In fact, drug spending in the U.S. is about 14% of healthcare spending, slightly below the average for the rest of the world. While total U.S. healthcare spending is higher than other developed nations, this spending allows American patients to receive cutting-edge healthcare earlier than any other country in the world. However, the burdensome copay obligations imposed in the U.S. are hard for patients to meet and undermine access and health equity. Remarkably, the GAO found that patient copay obligations often exceed payer costs for their drugs. This means that patients sometimes pay more for their medicines than their insurers. Clearly, this part of the system is not working as intended. We support proposals to reconcile this inequity and to ensure patient access. As outlined in my testimony, Congress should stop middlemen from taking for themselves the assistance that pharmaceutical companies intend for patients. And finally, it is essential that we reject the price caps and controls that exist in other countries which stunt innovation. Our nation's robust biopharmaceutical industry was created by policy choices that prioritize earlier patient access to breakthrough medicines and incentivize investment in medical innovation. Thank you for the bipartisan efforts of this committee and for the opportunity to engage in today's discussion. I look forward to your questions.